Welcome to the Thinking Practitioner Podcast,
a podcast where we dig into the fascinating issues, conditions, and quandaries in the massage and manual therapy world today.
I'm Whitney Lowe.
And I'm Til Luchau.
Welcome to the Thinking Practitioner.
And welcome to the Thinking Practitioner Podcast, where Books of Discovery has been a part of the massage therapy and bodywork world for over 25 years. Nearly 3,000 schools around the globe teach with their textbooks, e-textbooks, and digital resources. Books of Discovery likes to say learning adventures start here, and they find that same spirit here on the Thinking Practitioner Podcast and are proud to support our work, knowing that we share the mission to bring the massage and bodywork community thought-provoking and enlivening content that advances our profession.
Instructors of manual therapy education programs can request complimentary copies of Books of Discovery's textbooks, and they're really cool, to review for use in your programs. Listeners can explore the collection of learning resources for anatomy, pathology, kinesiology, physiology, ethics, and business mastery at booksofdiscovery.com, where you, as a thinking practitioner listener, can save 15% by entering thinking at checkout. How are you doing, Whitney?
I'm doing well. Good to see you here today.
Good to be here with you today. We have an interesting thing to talk about.
Yeah, what are we jumping into today?
Yeah, we were going to take a look at this recent study. It explored the immediate effects of suboccipital myofascial release on pressure pain thresholds, neck range of motion, and proprioception. And the researchers compared actual pressure-based technique to a, in quotes, sham version that just involved light touch.
Yeah, interesting. At first glance, reading over this, these results seemed pretty promising, saying that there was some benefit in the pain pressure sensitivity sensations that they were testing. But there was also some other interesting kind of twists that came along with this too, because we saw, and we'll get into this a little bit more. So they found that didn't seem to be a whole lot of difference between the sham treatment and the sort of, quote, real treatment that was being done there. So
they both worked.
Yeah. So we'll dig into some of those fine points and look and explore a little bit more about what's done in there. One thing I did want to say here is that I was really glad to see something like this getting published, because it's the type of study that we need a whole lot more of, which is looking at, comparing, and really trying to zero down on what are the specific physiological effects of the different methodologies and techniques and approaches and things that we perform on a regular basis, which we're often touting the benefits of, but we don't have a lot of good research supporting those things. So nice to see something being done along those lines to investigate that.
Yeah, and of course it caught my eye, and it was in Tara Rosa's really cool newsletter where I first saw it. Caught my eye because of the P-word implications, the P-word being placebo. And as a sham technique, it's a placebo-controlled trial, essentially. And there's lots of, in my thinking, there's lots of effects in that realm that we can actually take advantage of. And this study teased some of those apart. Plus, it had myofascial in the title, which is, the full study was called Contextual and Placebo Effects of Suboccipital Myofascial Release. So how could I not read that?
That's right.
The authors, Ertuğrul Safran, I'm probably massacring the names, and Yaren Kaya from the Bezmialem University in Istanbul. I'm sure I didn't get that right. But they're Turkish researchers. They're physiotherapists who have studied manual therapy and proprioception and neck function and published before on these topics. And the study doesn't list any outside funding, and appears to be internally supported by their university, and there's no declared conflicts of interest. There's lots of studies out there sponsored by some of the benefits economically from the results, and this, at least from what we can tell, doesn't seem to be the case.
Yeah. Well, maybe we should go start off with kind of like a nutshell overview of what they studied and what they were finding to kind of summarize that. What do you think?
Sure. Their goal was they wanted to see what the immediate effects of suboccipital myofascial release were on the pain threshold. That's the pain pressure threshold, the cervical range of motion, and proprioception. And they had a control to capture or to compare the contextual or placebo effects of just being on a table and just being touched. But here's the question: why do you think they chose the suboccipitals? Any?
I wondered that. I looked at in reading the studies. I thought, like, that's an interesting muscle group to focus on here. And one of the things they really kind of didn't get into is, I mean, there's some anatomical things to talk about here. Is that with the levels of pressure that they were using in there, you got a lot of things that are more superficial than the suboccipitals that you're pressing through to get to them. So, how do we necessarily identify that those changes were attributed to the suboccipital muscles changing versus, let's say, upper trapezius or semispinalis or something else that they're working through to get there?
Yeah, they didn't specify any mechanisms or speculate about any anatomical effects. They limited it to those measured effects, the pain pressure threshold, the cervical range of motion, the proprioception. So, which is probably very practical, good study design. Say, hey, look, what are our effects? They're not going to speculate about like what tissue we're affecting.
Yeah.
So who were the participants and why were they? Here's the question that might need some thinking through. Why were they asymptomatic? They chose asymptomatic participants.
Yeah, I'm just going to guess that it's a whole lot easier to get a group of asymptomatic individuals that are a little bit more cohesive as a group, because you can just exclude anybody that's got particular types of pain problems that might be conflicting with what you're investigating. So I think from a research design standpoint, it's easier to start with asymptomatic individuals. But again, these probably aren't the people who would be seeking out this particular type of treatment for what's going on. So eventually we want to see a study like this replicated with people who are having maybe, let's say, significant cervical pain, headaches, things that were indicating problems in those particular parts of the upper neck and head region.
Well, yeah, I think it's because they wanted to focus on their measures. They didn't want confounding factors like symptoms in there. They wanted to see what happened with pain pressure threshold, range of motion, proprioception. And if you started with a group with varied symptoms, that would be a confounding variable. They just get more in there. If they it'd be interesting to have them study neck pain. And in that case, that would be a qualifying factor. You'd want people with neck pain. But in this case, they didn't want those in there, I think, because they wanted to focus on their measures.
Yeah.
So it was 30 healthy adults, and they put 15 into the myofascial release arm and 15 into the sham arm.
Yeah. Can we pause for just a moment and talk about, for those people who may not be as familiar with reading research papers and things like that, talk for just a moment about what is a sham treatment and why we would maybe want to include something like that.
Yeah. Sham treatment is a treatment that is purposely chosen thinking that it will not produce the desired effects so that you can have a comparison, a control. You can have a group that goes through many of the same variables that might be producing effects, but try to isolate a particular thing you're studying by having that in the main arm, but not in the sham arm. And placebo, sham, these words have become synonymous with fake or not effective, but interestingly enough, so many of the effects, it's really hard not to have an effect. So many of the effects that are therapeutic in any context, whether it's with a pharmaceutical or with manual therapy, seem to come along with the context, which is often relegated to the placebo or the sham arm of a study.
Yeah, and this certainly highlights one of the most challenging aspects of massage and manual therapy research is, if you've got a drug trial, it's a lot easier to create a sham treatment when you just have a chemical that has no, active components to it. But when it comes to something like manual therapy, it's pretty darn hard to create a sham treatment because anything that you do has some kind of impact or effect with the encounter, the therapeutic encounter, the level of touch and things like that. So it's particularly difficult to create sham treatments in massage research.
Well, but going back to pharmaceuticals, even in pharmaceutical trials, it's really, just giving a pill has an effect. And that's why they thought on the sugar pill. But yeah, you're right. People know if they've been touched or not. And in this case, they, let's see if we can compare their myofascial technique to the sham technique. They did for the technique they were studying, the myofascial technique they're calling it, they did sustained pressure over 5 minutes.
Mm.
And then in the sham technique, they mimicked the positioning and the 5-minute duration, but they only did light touch.
Yeah.
And there was no, interestingly enough, of course, for me as a myofascial guy, there wasn't any particular branding attached to the myofascial release, using it in a more generic way
Mm.
as manual therapists would. And that's where the name of my method, Advanced Myofascial Techniques, owes its lineage. It was the name that we used for work that focused on a particular way of thinking or type of tissue back in those days. Now it's more of a way of thinking. And they're saying, yeah, from that long-standing repertoire that goes back into at least the 1970s, and you can see roots of it back into osteopathy, they're doing gentle sustained pressure with the fingers under the occiput for 5 minutes, allowing the head to rest passively in their hands. And it was straightforward manual therapy approach with pressure in the main arm.
Yeah. So essentially, and I found this really kind of interesting because, in the sort of massage and bodywork world, we have a major, I think, problem just that we have this plethora of different techniques and modality names for all kinds of stuff. And somebody calls one thing a certain name and somebody calls the exact same thing something different. And the idea of when they called this myofascial release, I was particularly curious to read the study design and see, like, what are they actually doing? Because the way they describe the treatment, I would probably say there's a lot of folks who would put the sham treatment in the bucket of myofascial release also. Very light touch, possibly, it's getting neurological responses from the touch factors on some of those other soft tissues in the region there, because there's a lot of myofascial techniques that are kind of just described that way.
You're saying that a lot of us would include a light touch like their sham technique in what we call myofascial. Yeah, I think myofascial has the generic meaning of soft tissue work with pressure in this context, in the manual therapy context. If there's a massage therapist designing, they probably would have just said massage.
Yeah.
For example.
Yeah. So.
All right. So we get a little more specific about what they were measuring.
Yeah.
And how they did that.
Yeah.
So tell us about pain pressure threshold.
Yeah. So this was, one measure that they were particularly focusing on. This would be something I think pretty relevant for anybody who's having neck pain and wants to know, like, can they do something about it? So they had specific devices that they were using to measure the amount of pressure that a person could, that the practitioner was applying before the person was feeling a pain sensation. So that's what they're calling the pain pressure threshold. And that's one of the things that they were able to measure. That is sort of a fancy device they were using to measure the pain pressure threshold. And that was then compared against the pain pressure threshold in the sham treatment as well, to see which one of those, if either of them, had a reduction or, let's hope not, an increase from the results of the treatment. But yeah, they were seeing.
Checked everybody, gave them a measurement, how much pressure does it take to cause pain. Then they gave them the 5-minute treatment, either pressure or no pressure, and then checked again. And then they also checked cervical range of motion, flexion, extension, and rotation. And they used the goniometer to measure that. And interestingly to me, they did proprioception tests via repositioning error test, which is basically you start at neutral, you turn to your comfortable full range, and then the therapist, with your eyes closed, the therapist positions your head somewhere in that range, and you go back to neutral and try to go back to where you felt that last position. So it's checking the client or patient's internal sense of position with their head and neck, which is an interesting little exercise.
Yeah, it was an interesting choice, I thought, too. And again, this being of significant importance, we kind of didn't touch on some of the other factors about those suboccipital muscles, but they have a tremendously large number of proprioceptors in them and are also significantly active in maintaining and aligning head position in a lot of different planes. So that's one of the reasons that is the proprioceptive sense would be of particular importance.
Let's talk about what changed.
Yeah.
So within the myofascial group, the pain pressure threshold increased, meaning they could take more pressure before it evoked pain. The range of motion improved. And in other words, they got bigger flexion, especially flexion, for example. And then proprioception errors dropped. So they got a more accurate ability to reposition their head after the myofascial pressure technique. So what happened in the sham group? What happened
Yeah.
to
So
sham?
in the sham group, this is interesting because, they had improvements as well. So there was some increases in range of motion, and similar to what happened in the control or in the treatment group, they had similar types of improvements, not to the same degree, but still some significant improvements that they were finding in the sham treatment as well.
Well, you say not to the same degree. There were actually some, if I remember right, there were some measures that were greater in the light touch, but overall slightly less in the less pressure group, but not statistically significant. So if you
Yeah.
looked at it over time on any one of the outcomes, they had similar improvements overall. And especially with that small of a group, just 15 in each arm, they were saying there's actually no statistical difference in the outcomes for movement, pain pressure, or proprioception between the two groups.
Yeah. And again, for those, especially those of us in the massage world who don't really read a lot of statistics and understand those, that term that you mentioned about statistical significance, this is an important concept about you can have two things in a research study and find a difference in the results, but the differences are not greater than what we might expect with, let's say, a chance variation between those two things, and that's what we call the level of statistical significance. So if there's the likelihood, like flipping a coin is like, if you get six, you flip a coin 10 times and 6 times it comes up heads, that's not really statistically significant. If it comes up heads 9 times out of 10, that would be statistically significant. But again, when you have those kinds of things that don't really have enough difference to occur much more frequently than that's what we're sort of indicating is what we call the level of statistical significance.
Thanks for the statistics and probability lesson. That's great to keep that in mind, what that means.
Yeah.
And especially when you have smaller samples. This is like a medium small sample, 15 in each arm. There's that greater range, and so it's harder to be precise.
Yeah.
But this study does replicate or show similar results to other past studies that have tried to compare similar things, like Pinheiro in 2021 saw improved postural stability with suboccipital release. Kang 2023 found distal joint changes in suboccipital innervation. And Perez Martinez in 2020 had a self-treatment for chronic neck pain. And in like this study, they found improvements, but no significant difference between their real and sham treatments. So that's been, different studies testing slightly different things, but showing that, again, the contextual effects are just as strong as the therapeutic effects. In other words, pressure or whatever it is they're trying to test doesn't seem to leverage the effects of just getting a treatment overall.
Yeah. Let's peel that apart for just a moment and talk about what are contextual effects. Like what are we talking about when we say that, contextual effects?
Yeah, it's everything other than what you think you're doing. Meaning the place the treatment is happening, the expectations on both the therapist and the patient or client, the mood or the ambience, the effects of just being touched, as you mentioned, just getting a treatment. It might include, I don't know, astrological effects. There's all sorts of things outside of our realm of even being able to track or list them all. It's everything else that's about the context that the treatment is happening within.
Yeah.
And like we've said, so many studies show that much of what happens is because of the context. And being touched and being touched in a skillful way is important, but it's hard to say which part of being touched is the most important part. It doesn't seem to be more important in the context at all.
Yeah. So let me poke the bear here just a little bit on this context issue, because this is something that we get into a whole lot. And I just want to ask you a question about this and get your take on this. So does this study support the idea or maybe I should say suggest that technique is not relevant because both these things got a beneficial result?
Are pressure-based techniques still worth using if it didn't get any better results in this
Yeah.
study and a few others. Uh, Good question. I like pressure. It feels better to me sometimes than no pressure, and that's enough reason for me as a client
Yeah.
to want pressure. Now, it's with that said, it also means that I got to pay a lot of attention as a practitioner to my contextual effects,
Mm-hmm.
to the expectations I have, to our interaction, our relationship, to setting things up in a way that makes it likely they're going to have the results they want. But I think it comes down in my mind to preference. And also just the nature of studies. Studies are an average. They find an average for this group.
Yeah.
And there's going to be people that are different than the average. So it's even more important to tune what we do to the individual than just always shoot for the thing that works as an average for
Yeah.
everybody,
Mm.
which is what this is saying. There might have been people in the study, I don't know, who pressure gave them a huge benefit over if they'd been in the other arm and not had pressure.
Mm-hmm. Right.
What do you think? What did I leave out on that answer?
Yeah. My take on this is there are going to be people who are going to read something like this or other future studies that are like this. And we're going to say like, well, the takeaway is the technique doesn't matter because both those things got results.
Yeah.
And I think that's carving off some important context about context, if we can say that, meta context maybe, which is that the way in which you deliver a technique is a lot about what the context is about. And so
Yes.
that does mean that your skills and abilities in performing really good and effective manual therapy are still really important because that's part of what
That is
gives
the
the
context.
contextual relationship for a positive outcome.
That's right.
So I do think it still does matter a lot about doing something well and doing it right to be able to get those contextual, to maximize, let's say to maximize the benefit, to milk those contextual factors as much as possible.
Well, in a study or when I'm teaching a class or when I'm trying to think of what my client might need, it's really easy to get seduced by the what. What are we going to do?
Yeah.
What is the technique? What is the protocol? What is the progression? And this is saying the how is probably even more important, how we do it. And that includes the timing, the when, all that kind of stuff. But the way, the manner in which we do it, the way we approach it, the interaction we have, those kinds of things are even more important. So I think it's true in my teaching too. I mean, this is a myofascial study. I teach myofascial techniques. It's showing that sham treatments were the same. This is not good advertising for me, except to say that the only reason I teach what to do in my trainings is because how we do it is the most important thing we're learning together too.
Mm-hmm.
It really is the context. I mean, the what is just an excuse for getting really good at the context.
Yeah.
Always.
So maybe the what is the bait on the end of the line or something like that that's got to hook somebody to be able to get into the how or something like that.
Yes,
Uh-huh.
that's right. That's good.
Yeah. You have to get within the magnetic orbit of the how, and the what is what pulls you into the magnetic orbit of it or something maybe.
And it's not that, like you said, it's not that skill is nothing or these narratives we have that inform our choices. They're important too. All of this technical education that we do or technical knowledge can be really helpful too. That's those, like you said, those do get included in the context.
Yeah.
Wow.
And I also think, the descriptors, the narratives that we use, the narratives that we talk about with our clients about what we're doing, why we're doing the things that we're doing, those are really relevant on a level of having the client have a better understanding of what's happening in their body and be able to get sort of on the same page with us about what we're trying to achieve together in our goals of treatment. So having some kind of framework for understanding the nature of what we do, even if there's a lot of subtleties and varieties, things like that, I still think that's still really beneficial.
The ways we think about it, the metaphors we use, everything from, am I kneading dough or am I like massaging the clay till it's soft? Am I moving fluids in my work?
Yeah.
Am I changing layer glide? Am I refining proprioception? Am I increasing mobility? All those things we think we're doing, we think about when we're doing, you're saying there's some benefit to be able to communicate about that with the client and get them on the same page, or at least a little bit, so that we can be communing in our narratives.
Yeah.
And be organizing around the same context or expectations.
Yeah. And I think too, when you talk about it, and we didn't kind of like dive into a lot of the detailed anatomy about this, but as we said, you've got some really short, very small muscles here at the base of the cranium between that and the first and second cervical vertebrae that we're talking about here, these suboccipital muscle groups, a group of 4 on each side. And they did make a reference in the study here to something called the myodural bridge, which is a little slip of connective tissue going between rectus capitis posterior minor and the dura mater. And a more precision-oriented treatment, I think, like let's say a small focused contact surface, like what they were doing here with the fingertip pressure in these regions, is more likely to potentially have a neural and or mechanical impact on these different tissues than would be, for example, a broad-based contact with the whole palm of your hand working on the backside of the neck or something like that. So again, the nature of that way in which the touch is applied, I think, still can have some significant physiological ramifications and benefits.
You're saying that the anatomy-based narrative that includes some pretty precise details and some accumulated learning from the last few centuries can be a useful narrative in getting precise and getting specific about things that might be related to the patient's symptoms.
Yeah, I certainly think so. Yeah.
Mm-hmm.
Yeah.
And this is back to the person that says, well, then this study proves that techniques don't matter. It's a small study. It's one study. Like I said, there have been others that had similar results, but it checked 5 minutes of a treatment too. So all we can say from this one is, 5 minutes of pressure and no pressure had about the same results. I wonder what would happen if it was a full session, for example, or if they were checking more than immediate effects, because they checked it immediately after the treatment. If they checked it in follow-up, could work with pressure be expected to have more effects the next day, for example, or the next week?
Yeah.
And the other limitations they listed on their study was there was no follow-up. There was no blinded assessor. The assessor knew which technique the clients had had, the patients had.
Yeah. One of the things that I didn't hear in the discussion of the limitations of this study, and they probably, I don't know if this is something that didn't occur to them, or like, it's challenging because things differ in various different countries in terms of who does what kind of thing in the manual therapy world. Some of those definitions are quite different, but certainly, like here in the U.S., a lot of the physical therapists, or what are called physiotherapists in other countries mostly, are not generally as a large, again, this is a very broad generalization, but are not doing as much manual therapy all day long, every day, as they might be doing in some other situations. And so this is another interesting question, I think, for future research is like, does that practitioner, how much does that practitioner matter in terms of their developed and refined palpation skill levels in doing these types of techniques? Does that make a significant difference that this was, they did say these people were trained in this specific version of myofascial release. So that certainly is beneficial. And I think it'd be interesting to look in, like, how much does that matter? How much does who the practitioner is and what their level of skill and training is. And we're getting into other contextual factors there, but I think it's relevant.
Certainly when someone who has a lot of experience touches me, I respond differently.
Yeah.
I can feel that.
Mm-hmm.
And that's there's a lot to be said for native talent too, but there's the training piece where I just go, okay, I'm not the first person they touched.
Yeah.
I can relax into this.
Yeah, and another one of the very difficult things is this is why manual therapy research is so challenging, because we have so many of these confounding factors to tease apart and to try to get something that eliminates all those confounding factors, gives you an extremely sterile and unrealistic kind of treatment environment where this isn't how it works. Maybe you want to study this particular type of technique done with 5 strokes only with X amount of pressure in this context here. Like that might be helpful for making a clean study, but it's just not what happens in the real world.
No. Well, what do you think are the takeaways? What do you think we should be? Just to recap here, to pull it together. What are the main
Well,
things you'd like our listeners to be thinking about?
yeah, I mean, I think, first of all, I think this is a good illustration of we need to dive into what are the impacts of some of those contextual factors in some different ways. Like maybe we can design some studies that can look at those different contextual factors. And this is one of the we don't have a lot of these kinds of studies that compare different techniques and methods in manual therapy. They were oftentimes we're oftentimes comparing it against something else like no therapy or some other type of radically different type of treatment. So
Or like this one, lumping all the contextual factors into one bundle. And you're saying there's
yeah,
a lot to be learned by teasing them apart.
yeah,
Why are we just studying the pressure, no pressure? Why don't we study the like talking, no talking, or eye contact, no eye contact,
yeah,
or incense, no incense, or
uh-huh,
cold room, warm room,
right.
or whatever? There's lots of things. Session duration, all kinds of contextual factors in there that could be having just as much impact.
Yeah, so there's a lot of further places to go with these kinds of things, but I absolutely applaud them for moving in this direction and starting to look at some of these things and giving us some other things to think about in terms of like how do we want to try to get more precise in our understanding of what we're doing.
I'm still riffing on that. White coat, no white coat. Stethoscope around your neck,
Right.
crystal around your neck. We could
Yeah.
just go down the list of all the contextual factors and start to compare them. That'd be pretty.
Yeah.
But it
Gongs
also
or
makes
no gongs.
no, yeah, whatever. But it also makes me think that as I'm working now with people that have been practicing for a long time, but I know you and a lot of our audience works with people just coming into the field. I think there's a lot to be said at any stage in our practice for learning more about contextual factors. We do
Yeah.
tend to get, like I said, seduced by the what, and the how seems to be just as important. And that includes not just the nuances of applying a technique with your hands, but the way you set up the whole interaction experience for
Yeah.
yourself and for your client. I think there could be a lot we could leverage we could get from training and attention to those skills as well.
Yeah. And you and I both are in the same boat as educators who are trying to sell education strategies for people. It's hard to sell that in an educational setting of
Oh yeah,
the
they don't sell at
context to
all.
things. Yeah.
No, there's no need. Yeah, if I taught a context class, I don't know how many. Some people would sign up, but if I taught like a injuries class, like
Yeah.
that's going to get some takers.
Yeah.
Something with a problem in the title, that's going to get some takers.
Yeah. So, all right. Well, what's next on our? We talked a little bit about any other takeaways that for you from this that other than what I was saying.
I think it's just an argument for, again, being people doing this work, doing it
Mhm.
in the way that feels right to us as a person, working with another person. The whole human side of it, this is just more evidence, if you will, that that's where things really count. That when
Yeah.
we show up as a person, we listen to each other as people, that then the effects are really good. That includes, like, for sure, empathy, touch itself, the communication around expectations or what we're doing. All those things, I think, are just such crucial skills and the essence of what we offer and do.
Yeah. And let's not also, I think, bury the magic that's sort of illustrated with something like this, which is simply touching somebody in this area had some significant benefit and effects for them. And that's what lots of our folks are doing every day, day in, day out in the treatment room with their clinic, with their clients. And sometimes I think that gets lost in the shuffle about how incredibly powerful and magical all this stuff really is on a regular basis.
It is magic to experience, but then also just thinking about it. You mean someone can position their head more precisely after I've touched them, either with pressure or non-pressure, just from 5 minutes of touch, they get
Yeah.
more precise in their positioning? That seems magic to me too.
Yeah. So some
Wow.
good things I think that are illustrated in this inquiry.
That's right. We'll put a link to the full study in the show notes. Again, thanks to Budiman Menanti from Terra Rosa for spreading the word about this study. And I want to thank our sponsors, Associated Bodywork and Massage Professionals. They proudly support us, and they are the premier association for dedicated massage and bodywork practitioners like you. When you join ABMP, you're not just getting industry-leading liability insurance, you're gaining practical resources designed to support your career. From free top-tier continuing education and quick reference apps like Pocket Pathology and 5-Minute Muscles, ABMP equips you with the tools you need to succeed and grow your practice.
And ABMP is committed to elevating the profession with expert voices, fresh perspectives, and invaluable insights through CE courses, the ABMP podcast, and their Massage and Bodywork magazine, featuring industry leaders like my co-host Til and myself. Thinking Practitioner listeners like you can get exclusive savings on ABMP membership at abmp.com/thinking. So join the best and expect more from your professional association. Thanks again to all of our listeners. Thanks for hanging out with us today. And to our sponsors, you can stop by our sites for the video, show notes, transcripts, and any extras. You can find that on my site at academyofclinicalmassage.com. Til, where can they find that with you?
Advanced-trainings.com. We want to hear from you. With your ideas or input about the show, just email us at info@thethinkingpractitioner.com or look for us on social media and YouTube. I am at Til Luchau. Whitney, where can people find you?
Also on the channels under my name, Whitney Lowe. Thanks very much. People can find me over there, and we would really appreciate it if you would rate us on Spotify or Apple Podcasts, wherever you happen to be listening to the show. It really does help other people find the show and helps us keep it going here. So please take a few seconds, if you can, to do that. And thanks always for sharing the word, and tell a friend, share the word as well. And we'll see you again next time.
I'll look forward to that, Whitney. Thanks for today.
Okay, thank you.